Hello, my name is Kaitlan Ostendorf, and I'm competing in the Riverwalk Academy Chapter BPA. The topic that I'm competing in is the Health Administration Special Leadership topic. This presentation, I'm going to explain the pros and cons of adding personal care in a medical facility. I'm going to start this presentation with my best friend. My best friend suffers from something called POTS, which means that her blood is getting stuck in her leg and it's not going all the way to her heart, causing her to pass out multiple times a day. Sometimes she can pass out up to 100 times a day, and other days just 1 or 2 times a day. Now, when you pass out, you have to go to a hospital. So, of course, we went to a hospital. In fact, we went to 3 major hospitals. The first hospital wouldn't listen. They told her to just drink water because water fixes everything, right? And then they also even sent her home and said it was just odd. The second hospital was unkind, also refused to listen, and told her she could even start driving soon. I don't know about you, but if I learn that the driver in my car passes out multiple times a day, I'm not going to get in that car. The third clinic, it was very different than everything we've experienced. The first appointment was set just to listen to her, all of her problems, everything she's been through, and even her personal life. They gave her a lot of books to study to help her explain what is going on with her, and even personally wrote an email to her heart doctor explaining what's going on. Now, customer service is really important in a hospital. Now, you might be thinking, customer service, hospitals, that doesn't make any sense. But let me explain. There are 4 major things with customer service in hospital. The first one is responsiveness of hospital staff. Your staff needs to be moving as fast and as fast as they possibly can. The reason they need to move fast is because a second in a hospital can change a lifetime. The second thing is communication with nurses and doctors. This is really important because nurses need to know what's going on with the patient, and doctors are the ones who know that. Doctors need to tell the nurses if they need to up the medication or lower the medication, or if they need to have more water going into their systems. The third thing is communication about medication and treatments. This is really important because you need to know what kind of medication you're taking. You also need to know what kind of treatments you're taking. The reason why that's important is because you need to know the side effects you're going to have, how long you're going to be taking it, and what's going to change in your life because of this. And the last and most important thing is information provided at discharge. Now, you might be thinking, why is that important? That's the boring part of a hospital. And it is boring sometimes, but it's also really important because after this, there's not going to be doctors and nurses around you 24/7. It's now your job to take care of yourself. In total, companies lose about $1.6 trillion a year due to bad customer service. That's a lot of money going down the drain. And there was a survey put out about 2 years ago asking if customer service was important when choosing a company. Over 90% of people believed it was, and the other 10% were just stupid people. Now, you might be thinking, this person's a genius, I should start giving her money, and I completely agree. But before you give me the money, let's talk about important things about a hospital. Policies and rules. What's the biggest policy going on right now? Masks. Every time you go to a store or a hospital or literally anywhere, there's always that sign on the door saying, please wear a mask. How are you going to be more caring if you're wearing a mask and standing 6 feet away? That's a good question. But I believe you can, because listening is really what's important. If the doctor is listening to you, that can change a patient's thought about that doctor, because that doctor is taking the time out of his or her day to listen to you. A doctor, when you go to a hospital or a doctor's office, usually the most time you spend is with the nurses. The doctors are only in there for like 15 minutes, but then they're gone. And then the nurses are the one who give you the shots. They're the one explaining what's going to happen from now on. What if that was changed? What if doctors spent more than 15 minutes? Now we're going to talk about the positives and negatives of adding personal care in a medical facility. Let's start with the positives. The positives are going to be happier patients, allowing you to have more patients because they believe that this is a great hospital to go to. It's also going to give you patient recommendations. That means that patients are going to tell other patients to come to this hospital, causing you more money to come in through the door. Oh, it's my bad. It's going to increase the population from mentally scared patients. What I mean by that is a lot of the patients that don't come are the ones who need the most help. The drug addicts and the mental disorders are what I'm talking about. They don't come because they're afraid they're going to get reported on, or worse, go to jail. But I believe if we created a program to help those people and not report them or take them to jail, I believe we'll actually be able to help the people that need the most help. It's also going to create a great relationship between the patient and the medical personnel. That's really important because if you don't like your doctor, you're not going to tell them what's going on. I don't even tell my friends what's going on with me. Why would I tell someone I don't like? However, there are some negatives. Appointments will take longer, which will cause scheduling issues, and clinicians and patients may get too close in their relationship, causing legal problems and more money getting lost because you're having to go solve those legal problems. Patients may also become manipulative, thinking that they're in charge of the doctor and they can tell the doctor what to do, even though the doctor's the one that went to college for 8 years. Now we're going to go to the conclusion, and then I will open the floor to questions. In the conclusion, patients are what is most important. What I mean by that is when you're going to a doctor or a hospital, what's really important is the patients. You need to tell them, you need to help them figure out what's wrong before they get more sick or worse, even die. Saving lives is what is most important. It's not about the green paper or money. It's not about that. It's more about the patient itself. And a schedule can be organized to help both the clinicians and the patients. However, there are some cons. Clinicians may not have the time. When you go to a hospital, or when grandmothers and mothers go to a hospital, there's always gonna pull out their phone and show hundreds and hundreds of pictures of their kids or their grandkids, which is always adorable and you love that. However, you don't have the time for that because that takes millions of minutes because it's millions and millions of pictures, right? So that might take time, causing it to not have enough money because you're losing patients because you're not having enough time for patients. And that can be a huge problem. And scheduling may not allow it to work. But I believe that we can allow it to work because we can just work together and figure out a way. But it's really up to you to figure out what you think is most important. Now I'm going to open the floor to questions. Thank you.